that I've received here in Sri Lanka. It has been excellent. It's been wonderful to be here. I thank particularly the colleagues, but I now consider friends, both in the ministry and also my colleagues in WHO and UNICEF. So I wanted just to say thank you very much for that. And for today, to be able to join you, I commented on Friday that I didn't like the word that I'm here to educate. I'm here to be part of the discussions and to learn along with you. And so I'm very grateful for that opportunity to do so. And I think in this room there are all the different stakeholders that are really needed and necessary. It is not just the colleagues at the senior level within the ministry, but it's actually the directors and the hospital managers and people on the ground that are essential to involve in this discussion. I'm very conscious that Sri Lanka is in a time of economic crisis, and so forgive me because I do not know the realities of this each and every day. I have read about it and I have heard about it, but I cannot experience it from a distance. But I do appreciate that this is a very real phenomenon for everybody in this room and in the population. And it's in this context that we can absolutely say that infant feeding matters and that breastfeeding is crucially important. We've heard a little bit about the benefits of breastfeeding, and one thing that we can say is that the evidence around the benefits is very strong. We understand more and more about the human biology, the influence of breastfeeding on lifelong health and development, on maternal health, and most critically upon survival of young children. So I'm just going to show you 2 or 3 slides, and I'm not expecting you to read the data or anything. It's too small and from a long distance. The main message is that there is a body of high quality evidence behind all of our comments and statements that breastfeeding is a very, very valuable intervention for young children. We have done systematic reviews and modeling, and we see that if we were to increase breastfeeding practices globally, over 800,000 child lives would be saved every year. We know that breastfeeding has a profound impact, not only on survival, but on morbidity. It would reduce episodes of diarrhea. It would reduce episodes of pneumonia. The evidence is strong and present, and the impact on hospitalized care would also be very, very significant. It's not just against survival and diarrhea and pneumonia. Breastfeeding protects health throughout life. It's important for protecting against type 2 diabetes. We see the burgeoning pandemic of childhood obesity, and breastfeeding is the single most effective preventive intervention with an 11% protective effect. We see that again in these systematic reviews, and we also see clearly today the impact on childhood development and intellectual performance at 30 years of age, and it has an impact. The problem in a time of economic crisis is that the timeline and the crisis is here and now today, and we do not really, we don't feel that we have the time to have these long-term perspectives. We've talked about maternal health, and the work that we've done on a series of Lancet papers show that each year that a mother breastfeeds reduces her risk of invasive breast cancer by 6% for each year that she breastfeeds. It also reduces the risk of ovarian cancer. So it's not just the benefit to the child, but the benefit to the mother. Every year, breastfeeding saves about 20,000 deaths from breast cancer. And if breastfeeding were scaled up more, then another 20,000 deaths would be amongst mothers would be prevented. And for those who are in programs and managerial positions, there's a very strong economic case for investing in breastfeeding. Again, the details we will not go into today, but when you look at the long-term effect of what breastfeeding contributes to childhood development, globally, it translates into $302 billion every year because of improved childhood development. And if you look at the effects on health systems, which is very real today, then breastfeeding reduces annual healthcare costs. Simply in the US, UK, Brazil, and urban China, it reduces costs by about 400 million on an annual basis. So that is a very relevant figure and value to be thinking about even during the immediate economic crisis. The strange thing is that despite all this high quality evidence for the benefits of breastfeeding, we see that over the past 20 years, breastfeeding practices globally, that fewer than half of all infants are actually fed according to WHO recommendations. Less than half. Even whenever we have this information and education, there is something that is not happening. So this is what we see. We see that exclusive breastfeeding rates, these are the lines at the bottom, the solid lines, are only increasing slightly. Continued breastfeeding rates, the dotted lines at the top, are about flat. Now, Sri Lanka actually does well in these numbers, but we've got to be saying that you cannot just sit where you're, at the moment and just say, take anything for granted. Because what we see is a global trend, and what we see on this graph, again, it's hard to see the numbers, but look at the black line. Because on the horizontal axis, you have GDP per capita. So as you go further to the right, this is where the GDP per individual within a country is getting better. And what you see on the vertical axis, the one going up and down, is the amount of sales of formula milk. So as you go to the right, you see that there is more retail sales of formula. And we are seeing this all over the world. And this is not just the dollar value or the metric tons. This is per individual child. So as you are seeing economic development, you're having more sales per individual child. This is an analysis that we also saw within the Lancet. And for each doubling in national GDP per capita, you have a decrease at 12 months breastfeeding rates of about 10 percentage points. And this really asks the question, why or how does this happen? Part of it is probably because women are going back into the work environment and there is inadequate maternity protection. And the second reason that I can think of is that as the economy improves, there is greater disposable income at family level, and families are then the target of marketing. And so we see these two areas where we still need to promote breastfeeding and support it through maternity protection, but we also need to take cognizance of marketing. So we see the figures in Sri Lanka from 2016, which are, they are right up there in the very best globally. But you're in an economic crisis. And so it begs the question, can you actually increase your GDP without undermining breastfeeding? Can you avoid the trap that every other country has fallen into? Because there is an expression, never waste a crisis. And you can be absolutely certain that the formula industry is seeing this crisis in Sri Lanka and looking to the opportunities. And the question is, does the public health community also recognize this important time? So I just want to talk a little bit about marketing. There are many reasons why women don't breastfeed. Work constraints, inadequate maternity protection, perceived milk insufficiency. She doesn't think that she has enough milk. There are many changes in societal norms, and I don't know all the circumstances in Sri Lanka. I can tell you from the research that we look at globally, these are the types of things that happen. Poor support within the health system is a critical one. The early initiation, the support for exclusive breastfeeding, are health workers giving a consistent message? And I'll come back to that a little bit later, but if I was to ask everybody in this room, the fact that you are here probably means that you are a supporter of breastfeeding. You believe in breastfeeding. And we undertook a survey in 8 countries. We interviewed 8,500 women and over 300 health professionals. All the health professionals said that they believe that exclusive breastfeeding is beneficial. And I'll show these numbers a bit later. But when you ask the mothers, where do you get your recommendations for formula milk? It is mainly coming from the health professionals. So we as health professionals, we say one thing, we believe this, but then we do something that almost contradicts that. And again, in a time of economic crisis where probably the salaries and the incomes of health professionals are also stretched and vulnerable, then the question is, what is industry doing to try to influence our behaviors? So, although there are many reasons at the family level or for individual mothers, work, etc., marketing is unquestionably an influence. So, very often when we see the word advertisement, so these are some images from products in Australia, and you see the same name, the same images, and all they're differentiated by 1, 2, 3, 4. So these are products for different age groups. So in Australia, they aren't allowed to market for foods for infants less than 6 months, but they do it for the older age groups. And this is what we call cross-promotion, because they don't need to market for the young aged product because they're marketing for the older ones. And this is something that we hear is going to be addressed in the updated food labelling in Sri Lanka. So that's a very good thing. But sometimes all we think about are these simple adverts. Here's another one. And where this image of the mother, the child, industry spends a lot of money, and they engage the highest and best marketing agencies and science to design the image in a way that is very engaging with the family. They put it on it inspired by breast milk research. What they're actually saying is formula milk is as good as breast milk. So it's the subconscious message that they are giving, and this is what they research. They don't look at the p-value of the epidemiology and the statistics. They're understanding what is the trigger to both health workers and to the individual mothers. And so what I think is that we have been guilty of is a very superficial and naive understanding about marketing. And there were a series of papers published earlier this year in The Lancet. And as part of that work, there was a framework developed. Again, it's hard to see from a distance. But really, the single is very simple, actually. It is not complicated. What we see right in the middle is that the objective and the aim of all marketing, not just for formula milk, is to shape and influence the social, the professional norms and values and beliefs. Are we absolutely convinced? I remember asking whenever I was in South Africa amongst my colleagues, consultant pediatricians, and we had a room of, there was about 30 or 35 people. How many of you absolutely believe that breastfeeding by itself is sufficient for 6 months? And I'll tell you, my consultant colleagues were hesitant to put their hands up. They really weren't convinced that exclusive breastfeeding was sufficient for 6 months. And that uncertainty is all that is needed to translate into recommendations for formula milk. And what we see in Europe and North America and in other countries is a belief amongst families that giving formula milk is inevitable. It will always happen. It may not happen at birth, but it may happen at 2 months or 4 months or 8 months, but all children will be formula fed. That is the belief within communities and families in other parts of the world. And that is because there has been a slow process of influence. And this marketing is all about altering decisions in civil society, amongst health professionals, amongst families and communities. But it doesn't stop there, actually. Because I know that some colleagues would point and say, well, that health professionals are the problem. But in fact, health professionals are simply a target. And your directors in this room of hospitals, the ministries and the secretaries, not just health, but in trade and labour, they are all targets of marketing because they influence how policies are developed, how tax is levied, and ultimately the environment within sales occur. And this is what we see. In 2019, the sales of formula milk were about $55 billion. And in 2019, a minimum of $3.5 billion was spent on marketing. That's an absolute minimum because it doesn't include lobbying, social media, or the sponsorship of health professionals. And this type of money gives industry enormous power, and it enables them to actually take on sophisticated political strategies. They present a very kind and sort of benevolent face, but then they do everything to undermine regulations. So as you have your new regulations coming up, you need to protect every statement in the draft legislation. What we see globally is more and more of the normalization of public-private partnerships, of industry moving into hospitals to provide a service. But they are there for a reason. We see in Ireland, for example, where the lobbying companies for the dairy industry and the formula industry lobbied government against improving their protection for breastfeeding in the Maternity Protection Acts. They directly lobbied against the extended and paid breastfeeding leave because it would hurt their sales. So really just in concluding, I would say, if you are not going forward, you will go backwards. Where you are in an enviable position globally, you cannot just sit there. Because if you do not continue, you will move back. And industry, I guarantee it, are constantly strategizing about how to enter markets. So you need to continue to promote and support breastfeeding. But I would say that information and education, both for health workers and families, is important, but it's not enough. You've got to do more than just information and education. There are many other effective options, and you have excellent technical people in this room. I don't need to go into those details. But breastfeeding is responsive to supportive interventions. Maternity protection in all work areas. And I neglected to put in anything about the informal economy, which is massive. In India, it represents almost 90% of all working women. They are in the informal sector, completely absent of maternity protection. In Africa, it's between 78 and 85%. It's a massive sector where these women don't have any access to support. But you also need to be thinking about the regulatory response to marketing. In every country, in every region, industry has argued for self-regulation. It has never worked. Sri Lanka has a long history of legislation to protect breastfeeding. It's admirable. You have new food labelling coming in January. You have draft breastfeeding code legislation coming up. But Dr. Daniel presented this one, that within the region, there are still vulnerabilities. There are areas where things can be better. So, for example, there have been no meaningful sanctions in Sri Lanka, but then there have been no meaningful sanctions anywhere in the world. So how is it that you can have legislation, but unless there is monitoring and brave leadership to actually impose sanctions, then I think we will remain vulnerable. Thank you very much indeed.